What's up, YouTube? Welcome to another episode of the Undergrad Forum. Now in this video, we're going to talk about what do I have on my cell phone, what apps do I use. So I use an iPhone, I got an iPhone 6s Plus. I picked the plus size because I just think having the larger screen is nicer. So let's go through some of the medical things that I use. Basic things, obviously Google Maps, can't live without it, get around. Dropbox, I just have a lot of files on there, works very well. So now let's get into some of the medical things I use and why I do it. So first thing you'll notice here is Adobe Acrobat. Now, something that's kind of may seem odd to you is why do I use Adobe Acrobat? Now, you can put a lot of books on here that are PDF files. And you can buy these, you can get them however you do, get your hands on them. So say you're looking at here, something that many of you know, first aid for USMLE Step 1. Say you have a question about something, you're like, man, what was that one thing on that one page of first aid? And you want to type in the word, let's type in the word sarcoma, right? The cool thing about putting in PDFs on Adobe Acrobat is you can search things on your book. And there you go, it like lights up in green and it just says, okay, you can text next. It's highlighting all the words sarcoma and letting you search through the book in Command F function things that you want. So, and you can do that obviously for all the books. So I have my various neuro books that I like to reference. I still have some things that I think like first aid, for example, I still like it. I still have things in my mind where I'm like, what was that one thing on the page of first aid? And I think of the word and it comes up. And this, you don't need an internet connection for, you just drop your PDF books right on there. And what I like about it is, say you're on the wards or you're running around and you just want to kind of look up a little paragraph about something. I like to use current, like here's like current neuro, for example. It's like a page or so on any topic that you want. It's a quick little review. I also used to do it for medicine. This version I have is old, but it worked outrageously well because a lot of times when patients would come in, especially as a med student, I use it a little bit less as a resident now, but as a med student, what I used to do was think to myself like, oh, I need about a page of something to read real quick before presenting to my attending on a thing that's new for me, and that's what I use current for. So Adobe Acrobat, I think if you use it like that, by putting in your PDF books, it really puts you at an advantage. Now, MP3 Books, that's a paid app that I use. I think it's like 99 cents or something. But here I keep all my audiobooks. I am very into audiobooking. This is a book called The 7 Habits of Highly Effective People. But the nice thing about it is you can put any book you want on here. And here, like MKSAP Neurology, any book you want, you can just put on there. The reason why I like that is if you have a commute to and from school or work or wherever you are, audiobooking is a star. And if you have your own MP3 versions and you're not using Audible, you can just throw it on there. And often there's lots of board review stuff. I mean, people used to use Golion Audio in the past. I think it's used a bit less, and you can put it on there. And it knows where you stopped, so when you restart it every time, you don't have to worry about it. So MP3 Books, if you have MP3s that you have your hands on, you want it to remember where you were last time when you opened, and you can use it for audiobooks or medically related books as well, or audios, excuse me. VLC Player is my next one. This one I think is fantastic. This one is free. Here you can like make folders, but you can put various videos on here that you have your hands on. For example, if you have Pathoma videos, I still keep mine on here from Pathoma Neuro because I just think it's good. Board review stuff you want to watch, you can just put all the videos on there, and if you have a large enough hard drive, here's like a video on headaches.
Hi everybody, and welcome to our module on headaches.
Right, you can just put lectures on here and watch them. You can watch them in your car, connect it up to your computer and listen, or excuse me, to your car and listen. Any video that you have, you can put it on VLC Player and just watch it. It's fantastic. And another beauty of that is that you can listen and watch videos on the go. You don't always have to have your full laptop with you. Next is an app I like called Diagnosaurus. It's got like a dinosaur, it's adorable, but it's real. It's by McGraw-Hill Medical. What I like about it is you can search differentials for things, and it really just helps you sometimes when you're writing an assessment and plan, help you think. Let's go, for example, something really basic. I mean, it has like things you have to pick from. Let's just say you pick chest pain. It's going to give you the differential for chest pain, right? And it's things that are similar to it. Or say you're thinking of something a little bit more complex. Say you think about multiple sclerosis, right? If you're thinking about MS, say you have a patient in the ED, you're like, man, this patient's got multiple neurological complaints separated by space and time. It's kind of making me think MS. There's lots of MS mimics in the world. It helps you with the differential. This is a nice, I think this thing also, I think before when I got it, it was 99 cents. It may be like a few dollars now. But what's really nice about it is it just opens up your mind as to, hey, what else should I be thinking about with my differential? And also the other beauty of that is over time, you'll just start naturally learning how to build your differential by using the app. So not only does it help you on the go, it also helps you learn as you learn, or learn as you see patients, excuse me. This one, the UCSF Hospitalist Handbook, can't tell you how much I love this thing. This one's a little more expensive, but it's solid. I used it tremendously during intern year, and I still use it now. So say anything you want to learn, it's kind of like pocket medicine, but a little bit better designed. So let's go. So say you're going to learn about heart failure, and you're like, okay, it has all these different sections. I'm really always curious about acute management. So it talks about wet versus dry, what to monitor, evaluation, what should you be thinking on exam, what labs do you want to order, what diagnostic workup do you want, treatment modalities. Obviously there's different tiers of how ill you are, and each one it gives you dosing and rationale. It's honestly quite thorough. I'm always impressed by what UCSF puts out, and the Hospitalist Handbook is really no different. If you're treating a patient with seizures, how do you manage it? It tells you step by step. So, and really I think they've done an amazing job of having the app work so seamlessly and clean. It just works well on the go, especially when you're busy. And I think things like Diagnosaurus and the UCSF Hospitalist Handbook, those are real testaments to if you have good app design. When I'm busy in the ED and writing notes and seeing consults, if I go to your app because it's that easy to use and intuitive, you've done something well. Next app here is called MedCalc. I use this all the time. So say anything that needs a calculation is what, you can go to medcalc.com, but that doesn't always work too well. And here it doesn't require the internet. So say you're calculating FeNA. So say you're like seeing a patient and you're like, man, I wonder what this person's kidney function's like. And you're like, oh, I remember I can calculate a FeNA. But then you're like, whoa, how do I do that again? I forgot. And two, what do I order? If you're the intern, you got to put all the orders in. Pop this open, be like, oh yeah, I'm already going to get a plasma sodium and creatinine from like my BMP. Oh, got to order urinary sodium and urinary creatinine. Bam. It just helps. Or FE urea, if you have a patient on like Lasix, anything you need that's a common calculation is on here. Here's another one. A, B, C, D. It includes both scores for the risk of stroke after a TIA, and it even tells you. So let's just say the patient does have diabetes, does have hypertension, they are over 60, they have unilateral weakness, but it only lasted less than an hour. It tells you their ABCD2 score and explains the risk. And it gives you always similar things to compare against. So I think the MedCalc is solid. Epocrates, don't even need to explain Epocrates. It has all the pharmacology I could need. And here's what's cool about it. So here's like cyclobenzaprine. I had to look it up the other day, and I was like, okay, how do I dose this thing as a muscle relaxant? It tells me. I think this is really key. In the old days, people had this like small book called like Pharmacopoeia or pocket medicine thing, and it was annoying. But now with Epocrates, everything's searchable. So I like to use the adult dosing section and the pharmacology section to tell me how does it function, number one, and two, how do I dose it. Next app, you gotta just love and hate. Up to date, I don't even need to explain up to date. It just kind of works perfectly. Weather app, okay. Next over, my document management, all the things I like to use through the Google Sheets, Words, and also Slides. Other apps, okay, going into more medicine. Neuro Toolkit. This thing, not very pretty, I'll tell you, their OS is not very elegant, but it works well. NIH stroke scale, I love having this thing on here. Say you have a patient, I'll just kind of slam through these quickly. You do their exam step by step, and it tells you the NIH stroke scale at the end and gives you a summary. The nice thing is, in the beginning, if you're a neurology resident or you're having to do NIH stroke scales, you in the beginning need some practice, but once you've done a lot, it's kind of natural and will be second nature to you. Or say you have a patient with an intracranial hemorrhage and you want to calculate an ICH score, it has it built in for you. Let's say their GCS is not very good, they're older, and they have infratentorial and with intraventricular spread, well, obviously the ICH score is going to be 6. But let's just say they're not so ill, and let's just say they're doing okay, but they happen to be old, and you hit calculate, the ICH score is 2, and it tells you and explains how the ICH score works. So if you are a neurology resident, Neuro Toolkit, it is paid for, but it's fantastic. This next one is called IMD. It's free. Not only does it have the visual acuity test, it has like this thing called the magnifier and a pen light. What I like is this color vision exam. So if you have a patient that has optic neuritis, the triad of optic neuritis being pain with extraocular movement, red desaturation, and decrease in visual acuity, to check red desaturation, you use these. So this number is 12, and if you can't see it, it'll tell you, and you just run the patient through these and what they can see, and you can determine if they have red desaturation. So IMD for the win, in my opinion. Other medical things I have here, these are just very specific to like being a resident. QGenda and Amion are common services that programs will use to schedule the residents, and Doximity is just fantastic. iBooks, kind of like how I use it for my Adobe Acrobat. When I have an EPUB publication that I have access to, this is what I use. So say Pocket Neurology, for example, it'll just take you straight to it. Okay, and that's about it. I hope you guys enjoyed this video. I don't use that many apps, but the ones I use routinely on a daily basis. Adobe Acrobat to access my PDFs, MP3, Player to listen to my audiobooks and any kind of MP3 file I want access to. VLC Player to watch all my videos. Diagnosaurus to watch, to look up differentials. Hospitalist Handbook to look up management that I need help with, MedCalc to help me with my calculations, Epocrates for pharmacology, up to date for everything up to date, Neuro Toolkit for the neurology resident, and IMD for the red desaturation. There's one last thing which I forgot to mention is Evernote. It's simply a note-taking device. So if you have notes that you write and you want to be able to access them all the time and not have to keep in a binder, excuse me, I keep bumping the camera, I just use Evernote, and that way all my notes are not only searchable, but always accessible to me in my pocket. Hope you guys enjoyed this video. Any questions, drop them down below in the comment section. Let me know what apps you guys use. I'd love to kind of see how you guys use your apps. For example, how I use VLC Player and Adobe Acrobat. I don't know if it's unique to me or if everyone does it. I'd love to hear some feedback. And if you guys have cool apps to use or things that you kind of have tricks with your phone to be a better medical student or resident, let me know. Let the community know on Facebook. Love to hear it. And as always, guys, enjoy your studies.